Hey everyone, thanks for joining us today. I'm here with Priscilla and also California's Governor, Gavin Newsom. And we'd love to just get a chance to talk about how California is responding to the outbreak around coronavirus um, and what the governor is seeing, and also take some questions from the thread. So I'm just to get us started. California has two of the biggest cities in the country, and it's been a challenge to make sure that we respond well here. Yet the results so far in California, um, have been pretty strong and strong under your leadership for how the state is reacting to this. So I'm curious to get a sense from you on what are you seeing, what is working well, what isn't, and what's happening in California that isn't in other places that's leading to a pretty good response so far here.
No, I appreciate that, Mark, and I appreciate the opportunity to join both of you today. And it's a question we're asking ourselves a lot, and it's a question I know that others have pondered and some have opined. And I think it's just too early to tell. Look, let me contextualize where we are in this state. We were one of the first, in fact, we were the first state to start dealing directly with our federal government as it relates to COVID-19. We were the first state to bring in those repatriated flights onto military bases within the state of California. The first one came late January, and we started socializing the significance of this moment, just dealing with the protocols and procedures related to individuals on the military bases and the concern around people coming off those bases. We had the Grand Princess, feels like a year ago, but it was only a few weeks ago where we had to repatriate the Grand Princess, and it required us to put together all these processes and protocols on screening, isolation, self-quarantine, and begin to procure sites throughout the state of California. But it also primed a consciousness in this state around what was potentially coming. That led to local officials leading. It led to our efforts at the state level to do a stay-at-home order for all seniors 65 and over, and then the first state to do the physical distancing stay-at-home at scale. And then as a consequence of all of that, it's bought us, we think, just enough time that we can procure the physical space that we need within our hospital delivery system to get more PPEs, ventilators, and then ultimately today, what we're announcing, efforts to get more people and personnel to staff. So we just think we've done nothing more than buying a little bit of time, but we're not spiking the football.
So we're all staying at home and doing our best to be socially distancing. But what else? What should we be expecting will come next?
I think the key is not to run the 90-yard dash. The physical distancing we're doing, we quite literally believe is saving lives. And it's the question I get, and I'm sure you guys get it all the time as well, and that is, what individually can I be doing to meet this moment? And there's nothing more important or potent than that physical distancing. In some ways, it's not social distancing in the context that we want people to socially connect. No one understands that better than you two. We just want them physically to create the kind of distance where we can keep other people safe and healthy and all conduct ourselves as if we're positive, even if we haven't gotten the test. If we develop symptoms, to appropriate ourselves accordingly, but to assume that we do in the context of how we engage others, particularly loved ones and community members. The biggest mistake we can make is that we pull the ripcord before we've landed, that we somehow feel like, well, we've got this. And you know what? It's already been a few weeks, and that playground or park, that beach is looking really, really nice. And no one else seems to be out there. So why don't I go out there and play a little volleyball? That's the worst mistake we can make at this moment.
So what's your message to folks for what they should expect over the coming weeks and couple of months?
Well, let me be sober, Mark. Today we announced just in the last 4 days that we've seen a tripling of ICU beds. We've seen a doubling in the last 4 days of our hospital patients. We've done, though, a couple things to prepare for that beyond just dealing with surge. And the surge capacity in the state we're calling for is to get to 2/3 greater capacity than where we started, from 75,000 beds within our current system to 125,000 beds. But we've also done something else important, and that's slack. And that's reduced the census within the existing delivery system, eliminating elected surgeries and looking at ways to do more outpatients so we can really prepare for this. And so as a combination of those two things, even a tripling on the ICUs, even a doubling in the last 4 days of hospitalization, we feel we have multiple weeks, even with that kind of doubling or tripling, where we can meet capacity. It's when we move out 3, 4, 5, 6 weeks, if we see that continue, that we're going to be stretched. So we're doing everything in our power to continue to amplify the stay-at-home messages, the physical distancing, and increase the workforce that right now is creating real anxieties, not just ventilators and personal protective gear, but the workforce needs to prepare for the next month.
So maybe one more before we go to the news that you were just talking about at the press conference before this. But when you look, as a head of the state, at the responses that other countries have had, whether it's Italy, South Korea, Singapore, Taiwan, what are you taking as the lessons from those places for how you're leading California through this period?
Well, they took it seriously at a scale, candidly, we're still not. When you talk about the physical distancing, the fact that you couldn't even do essential business without having someone there to check your temperature, people appropriating themselves with the appropriate face masks, even if they're not N95s, those quality masks that we talk so much that are critical for our nurses and our doctors, but still doing what they can to keep themselves and others from contracting the virus. Their testing protocols and regimes. I know, and I appreciate that we're making progress in this space, but we did not meet the moment from the onset in terms of scaling the testing as some of the other countries have on a per capita basis. New York stepping up, we're getting there. This has been a stubborn thing for me. It's been a little frustrating, the lack of community testing, community surveillance, the more targeted testing to really understand where we are and where we're going to be able to answer the question you just asked me more substantively, and that is what to expect in the next weeks and months, the antibody tests, the serology that we could be doing, that we're getting there. But the throughput, the diagnostics, the delay in getting test results continue to be stubborn compared to some of those countries that you mentioned, where I think they leaned in a little bit more aggressively on the onset.
Yeah.
Great.
I've been thinking about the folks on the front lines doing incredible work in keeping everyone healthy and helping people recover, a lot of friends and colleagues. You made a specific call to action today for them to get involved. Could you tell us more about that?
Well, we need to surge, as I said, not just our beds, not just our personal protective gear, but we also need to surge our capacity in this system to provide, by providing the kind of flexibility that's required that, boy, Priscilla, you understand as a practitioner firsthand. We have, and we're so proud of this, and I want to make this crystal clear, we have the highest quality ratios, the highest quality personal protective gear requirements in the nation. And our nurses, the California Nurse Association and others deserve all the credit in the world for what they've done to raise the bar, not only in this state, but for the rest of the nation. But we're at a moment of anxiety, a moment of crisis potentially, if we don't try to loosen up some of our current licensing, current supervisorial ratios, and potentially look at scope of practice for nurse practitioners and other professionals. And so we today announced some flexibility in this space, temporary flexibility. We don't want to permanently roll these things back so that we can meet the surge. And we're also asking all of those individuals that have retired in the last 5 years, all of those nursing students and medical students that are about to graduate, people that have relicensing requirements, to check out this new site that we have, healthcorps.ca.gov, our healthcorps.ca.gov site, and we'll match you up. We'll try to meet this moment. We'll pay you, and we'll provide the kind of supports you need to get those licenses back up. And let me just say, forgive me for long-windedness, let me just say this to the two of you very formally. You two stepped up, and you're providing $25 million on top of that effort to help in things that the state's not prepared to help, and that's stipends for childcare, transportation, for hospitals, or rather for hotels, excuse me, where you may want to stay near the hospital and be in a hotel nearby. We didn't have the money to do that. And I just want to thank you too for providing that $25 million to help meet this moment as well.
Well, thanks, Governor. We're happy to support the efforts that you're taking. And as I said before, I think we're grateful on behalf of a lot of people for the strong actions that you're taking in leadership here.
Thanks, Mark.
I think a lot of people are probably wondering, how do they raise their hand and help out, right? Either with the program that you're talking about today, or more broadly. It's certainly been inspiring to see a lot of people come together in different ways to help address this. But what are you seeing? What would you say to people who want to find a way to help out, either retired medical folks or people who have other skills here?
Nonprofits.
No, I appreciate it. If you're retired medical, go to that healthcorps.gov, just like the Peace Corps, like AmeriCorps, healthcorps.ca.gov, if you're in that category. But individuals, beyond the potency and power they have as individuals to do more than anything else, and that's the physical distancing, but to contribute to Cal. We have a program, Cal Volunteers, to contribute your time and energy to help at the food banks. We've seen a significant decline in volunteers at our food banks. That required me to actually activate the National Guard, not for enforcement, but for humanitarian purposes. We have 980 National Guard now, men and women across the state, helping in that space on logistics, on warehouse-related food supply issues. That's one way. Give blood. We have to make sure that we're prepared to meet a surge of acute care, and you could still contribute your blood and go to the blood banks and learn more from the Red Cross and others in that space. We're going to do more in the next couple of days to get people to call a neighbor. People are social. One of the great diseases in this country is social isolation. People feeling socially isolated from the rest of the world, and a phone call just to check in to make sure your medications have arrived, your food's arrived, or just to check in for brain health purposes, mental health. We want to provide that toolkit for people so they can call their neighbors and just randomly call people and say, how you doing? And just check off on a human capacity. So those are areas where people can do more. And we have a site for the broad panoply of supports called COVID-19, covid19.ca.gov. Sorry about that .ca.gov, but that's government for you.
There's a lot of news about hospitals preparing and work that's happening on the front lines, a floating military hospital coming in. How are we doing in terms of bed capacity and ICU capacity in California?
I know we're such in a polarized frame, a political frame. We're in a presidential election year, and there's been a lot about governors and the president. Let me just, in the frame of your question, just make this point. The president of the United States directly himself directed the USNS Mercy to the state of California. And he did it before we were in acute crisis, so we can prepare not just the ship, but we can prepare for what the ship will do to decompress the rest of our healthcare delivery system. And I'm really grateful to him. And I mean that. I don't say that lightly. Heck, we're involved in 68 lawsuits with the Trump administration. I'm happy to call balls and strikes. But if you're going to call balls and strikes, you have to thank the administration and the president directly for that. But also, he provided these FMS, these field medical stations, which are a fancy way of saying 250 bed stations. There's 8 of them, 2,000 medical tents that are going up, 4 that are going up in the next day or 2, one that's already operational, that is helping, again, deal with the surge and allow us to decompress the rest of the system. But the question you asked is even more sophisticated in the need for a response that is not just in the aggregate, meaning the total number of beds in the hospital system, it's where they're located. And that's where the frame is very different. Certain parts of the state are stressed very differently than other parts of the state. And not just where you'd expect in the big urban centers, but also with the lack of resources in some of the more rural parts of the state, where I'm particularly concerned. They haven't been hit as hard yet But when they do, we need to make sure that we pre-positioned a lot of these assets to meet the needs in Kern County and Butte County, in Trinity, where they were having just a couple of days ago a hard time getting trucks up there for basic food supplies. So when we're complaining about lack of toilet paper, they were complaining about more than toilet paper up in Trinity. And so the question deserves an answer that's different in each of our 58 counties, each and different in each of our 470, 480 cities.
And what are you seeing on the other types of resources besides beds and ICUs, things like masks, other PPE, ventilators? How are we doing on that? And what more support do you need on that?
Well, we did better than most at first, because I was blessed to inherit 21 million N95 masks. We worked with the Trump administration, the FDA, to get a waiver because a lot of those had expired, but they were cold stored, and they were in very good condition. So we were able to get most of those out. It's not nearly enough. And I use N95s as a proxy because that includes coveralls and gloves and shields and more traditional surgical masks we're still in need of. But let me tell you specifically, as of this morning, we have distributed 32.9 million N95 masks. We have ordered, I'm not making this up, Mark, Priscilla, ordered 101 million more N95 masks. When you hear people talking in the tens of thousands or hundreds of thousands, they're not having a real and honest conversation with you. We need to be talking in the millions, tens of millions, in a state as large as ours, hundreds of millions. We need 1 billion glove sets in the state of California. And we need these ventilators. I got to tell you, if there's any anxiety I have on the supply side of things, it's the vents. And we need people from around the world. If they've got something in their basement, even component parts, send them our way. If you're in a community college and you're using one for training, send them our way. If you're in a surgical center and you're using anesthesiology, and maybe we can convert those to vent, send them our way. If you have any of these that you can procure for us directly, and you can get a ship or a plane to another part of the globe, send them our way, because we only have received 170 in a state of 40 million from the federal government. It's not a complaint, but they went directly to LA County, and they came, unfortunately, not working. We were able to get them up to your friends and neighbors in Silicon Valley over the weekend, and we fixed all of them. We're sending them back down to LA County, but we're going to need to get more. And this remains, to me, top of mind, because the one treatment, Mark and Priscilla, we know works. I know we talk about chloroquine and remdesivir and all the other related treatments are out there, and no state's doing more in terms of those trials in the state of California with our UCs in Stanford and USC and Cedars and Livermore Labs and Lawrence Berkeley Labs. But the one treatment we know works are ventilators to keep people alive. And that's why we really need more vents.
And where should people send a vent if they have access to one?
Oh boy, just go to our covid19.ca.gov website, and we will get someone right back to you. And again, I don't want to sound hysterical around this, because we currently are not. We've received, forgive my language, we have 4,252 ventilators that we've identified. The goal is 10,000. Candidly, that's phase one goal. We're going to need more than that. But I want folks to know that if we are talking in a month, I may not be as calm when it comes to the ventilator question than I hope I'm coming across at this moment.
Mm-hmm.
And maybe we should talk for a few minutes about testing and what you're seeing on that. And I guess for a quick moment, I also just want to thank you for your support on this, because one of the areas that Priscilla and I have worked through the Chan Zuckerberg Initiative is on medical and science research, and we helped to start this center, the BioHub in San Francisco, and working with your administration, basically have been able to repurpose a lot of the equipment and capacity that we have there in order to stand up more testing capacity there. But that's, of course, just one thing in the stream of work that you and your team have been working on. So what are you seeing there? How are we doing overall? Where do we need to get to, both to be able to support people in terms of individual treatments, but also for developing a broader public health strategy of understanding what's going on across the population?
No, and I don't want this to be an infomercial, but I also don't want to mislead folks. What you did with BioHub, I was emailing Sam Haygood yesterday at UCSF. Thank you for doing what you did on the testing. And you're a demonstrable example of what's happening across the state, but candidly, not at the scale that we're going to need it. This has been an area of frustration for me as governor, and as someone who's responsible to do more and do better. And this is an area where we have to do more and we have to do better. We have 22 labs in our state. They were never designed for the kind of throughput of testing that is required to meet this moment. And while many of those were up and running early on, and we were doing the tests, we started running out of reagents and these RNA extraction kits. And so we couldn't do as much as we'd like. And no sooner did we start getting more RNA extraction kits and more reagents, then we started having problems with specimen sample collection and the media to carry the specimen. That's the swabs. It's not an excuse. It's just to punctuate that a lot of what we see as headlines and a lot of what we're hearing on the news, it's not as good as it may sound. Some people are promoting new technology, say we can do up to X number of tests. Well, that up to may take weeks or months. Let me reinforce that. We now have the UCs working with you and others. We have private sector that have stepped in with these higher throughput lab tests. We now have not just Quest on the commercial side and LabCorp. We have new technologies that are being announced and promoted every day to do 45-minute tests, do 10-minute tests, to do home tests that don't require the old PCR components, the old test regimes, and we again do blood-based tests and the like. We're for all of those, and we're trying to bring that capacity to bear throughout the state of California. But to get to the kind of surveillance testing, the targeted testing, where we retest people on multiple occasions and see how movement and spread is working, and to work at the antibody level, and to do the things that are required for us to ultimately decide who can go back to work, who can't, how quickly it could move our economy, we have to exponentially scale the testing regimes. And so I'm encouraged by the progress on a day-to-day basis, but what we need is exponential growth in this space. We'll get there, but it cannot happen soon enough.
And then just one last question before we get to audience questions. On physical distancing, what's working well and what's not working well?
Well, a week ago, it wasn't working well at some of our beaches and parks in the state. You have these single trails, people are out. I mean, this is California's birthright. It's the reason we love our state is that there's no state more well endowed with Mother Nature's beauty and bounty. We have 280 state parks, and in many of these parks, there are trail heads to go down to the beach, but they're single trails. You can't practice single distancing when you're going like this with friends and neighbors. And so we had to slow down by doing these soft closures, the number of crowd or people that were creating crowds in these beaches. We now have soft closures in all 280 beaches, and we're going to start moving to hard closures that we're in real time. So that's working, and it's not. That's an honest answer, just as a specific proof point. Here's something else that I worry about. I have a short commute from my home to the State Operations Center, which is just filled with heroes from all across the country that have descended under one roof to collaborate and cross-pollinate ideas and approaches and strategies. Just seeing that commute every day get a little bit slower, which suggests people, and you know it from your own Facebook data, I imagine you're seeing where people, we have the capacity to start modeling and see, you're seeing people sort of go back to the old ways. And so I cannot impress people more. Maintain the physical distancing. As I said, it's like, you're parachuting down and you're getting closer to the ground, but that's not where you cut the parachute. You got to get to the ground safely. We've got to get to the end point, and that will be determined on real data. Once real testing goes into place, that will give us the assessment to say, all right, for all non-essential travel, maybe we can make some adjustments. And I hope in the next few weeks, the next month, we'll have much better clarity on what dates those are, where those dates may lie.
Yeah, that leads me to a question from Eduardo that says, why can't we just shut down completely for 2 weeks?
Well, complete to me means logistics nightmare, which is essential services. And when I talk of logistics, I'm talking about the farm workers in the Central Valley that are not only producing the food that is being consumed in our supermarkets in California, but all across the nation. They're essential at this moment. It's the warehouse that is sorting all of that, and it's those workers that are essential. It's the folks in the trucks that are picking up those that are essential to logistically get to other distribution centers that ultimately out into the supermarket. So I don't want to see those essential services shut down, those medical services shut down. We have to be thoughtful. I don't think he's implying that, but we have tried to delineate essential versus not essential. I know some people roll their eyes and say, well, why isn't my hairdresser essential when your cannabis operation is? We're iterating in real time, working with public health officials, working with Homeland Security at the federal level, and it's a constant and never-ending tweak of essential versus not essential. But we want to hold the line as long as we can. And we think we can do that with appropriate physical distancing. We can meet the spirit of his concern and question.
One that I think about a lot as a mom is just the childcare for folks that we're asking to serve in our hospitals and clinics. It's just necessary.
And we're prioritizing you in that respect, your colleagues in that respect, and our first responders to make sure their childcare needs are met, because we just cannot afford to lose our police, our firefighters, our sheriffs, and nurses and nurse assistants, and all the other heroes, including, let me just say this, I was talking to the grocers union the other day, and very emotionally, because they lost one of their members to COVID-19. And they said the grocery lines are the front lines. And that resonated with me. They don't need to show up at work. They could get on unemployment. Talk about heroes. Let them know that. Put a smile on their face by smiling when you see them, and thank them for showing up and taking care of your needs. They've got kids as well. The Teamster that's out there in the truck, they can't even get food themselves because they're doing 60, 72-hour a week shifts, 6-7 days a week. So there are a lot of heroes here, and I just hope we're all. I hope at the end of the day, if nothing else, we all soften our edges and become better human beings, and we have a deeper appreciation of each other. Because at the end of the day, there's no leak on your side of our boat. We will rise and fall together, and I'm confident we'll rise to meet the moment.
Well, Governor, I think we've covered a lot of ground. Is there anything that you would like to make sure that we get a chance to address that we haven't so far?
Well, I just want to thank you and Priscilla for this platform and the opportunity to share what we're doing in the state. Good enough never is, and I understand that. And there's so much more we have to do to meet this moment. I want to thank people for their patience in that stead as well, and understand that what appears self-evident today, conditions can change in real time and require us to adjust our approach, and just to understand that we are all doing our best to meet this moment head on, to also meet the needs of our homeless in the state of California. We have over 5,400 beds, hotel rooms that we procured, and we're trying to get people off the streets. And I know that's not happening soon enough and quick enough, and I just want folks to know we recognize that. But let's just take care of each other. And let me, in closing, also just take care of saying this, and this is not an infomercial as well. Mark, you were one of the first to call me, and you've been very helpful providing real resources, well beyond $25 million, to allow us to do these PSAs and allow us to connect with people, to let them know what's going on, and as well helping small businesses. And I just want to close on that. I'm a small business person. I started a small business right out of college. I opened 20 plus little businesses. That's not to impress you, it's to impress upon you. I'm deeply sensitive to the needs of our small mom and pop entrepreneurs, 1 or 2 customers, or rather employees. And we just have to meet their needs as well, so we have a place to go back to work And I just want to thank you and your platform for supporting our small businessmen and women as well. And knowing the next few days, we'll be talking a lot more about how we can support that community in addition to everything else we have a responsibility to do as well.
All right. Well, thank you, Governor. And we're proud to support you and your response, and we're proud to do what we can to support all of those on the front lines. And I think on behalf of a lot of people, I just want to thank you again for your strong leadership on this. I think it's making a really big difference. And just as one final plug, the link that the governor mentioned earlier was healthcorps.ca.gov. And we encourage you to check it out if there's a way that you can get involved in helping out with the medical response. Thank you again, Governor, for everything. And I hope you continue to stay healthy and safe and continue to do a great job leading through this. Thank you.
Thank you, Governor.
Thank you both. I'm grateful to both of you. Thank you for having us.